Hello and welcome to the hypertension presentation. This presentation is organized by medical studies or lectures I've attended that have provided helpful information that I thought I'd pass on to you. And it's really organized in not in order of importance of the information, but rather just in the reverse order in which I read the study. So without further ado, coenzyme Q10 is an enzyme in all of our bodies that is integral for a lot of vascular or cardiac health, and you can replenish your body's supply by consuming green leafy vegetables or supplement, and I've given you some dosages there in the presentation. Vitamin B6 is another important nutrient for vascular health. In the spirit of consuming a whole food plant-based diet, I've listed some good food sources there. Supplementation would probably not be as beneficial as consuming the whole foods, which contain 1,000 other substances that all work in concert to provide the greatest benefit. Mediterranean, or the related DASH diet, which stands for Dietary Approaches to Stop Hypertension. These diets are shown to reduce cardiovascular risk, and you can Google them. In essence, they are whole food plant-based diets with some seafood, low in salt, high in potassium, and very healthy for heart and brain. Black cumin is a spice different from regular cumin and has been shown to reduce blood pressure, as has ground flaxseed. I once heard a nutritionist say that if you were stranded on a desert island and could only take one food, it should be 2 tablespoons of ground flaxseed every day in your smoothie or oatmeal. Very good for cardiovascular health. Hibiscus tea, also known as sour tea, is beneficial for blood vessels and lowers blood pressure. Great addition to your afternoon tea drinking. Same with 8 ounces of beet juice, which helps your blood vessels to produce the nitric oxide that dilates them, thus reducing blood pressure. Most Americans are fiber deficient, and I set the floor at 40 grams per day. Our ancestors often got greater than 100 grams of fiber every day. Fiber comes from the cell walls of plant foods, and the more processed foods and animal foods that you eat, the less there is room for fiber. So try to focus on a plant-forward diet, and this will improve your blood pressure. Just to repeat myself, lots of fruits and vegetables, good for blood pressure. So are nuts, especially pistachios, have been studied specifically, as have walnuts. Walnuts contain omega-3 fatty acids, which are beneficial in reducing the risk of heart attacks. Like I said, consuming a whole food diet gets you the benefits of the other substances that walnuts have, and they have been shown to reduce blood pressure. Polyphenols are some of the phytonutrients that get missed a lot when people are talking about nutrition. People tend to focus on the macronutrients, fat, carbohydrates, and protein, and forget about the micronutrients like polyphenols. Cocoa, the skin of the red grape, which you can get from red wine, or non-alcoholic grape juice, is shown to reduce blood pressure. And I would point out that red wine can raise blood pressure if you overdo it. Garlic is important to include in your cooking or diet. It can reduce blood pressure. Same with vitamin C. And as mentioned before, potassium. Bananas actually rank 95th on the list of foods with the highest potassium content. So they're great and readily available, but sun-dried tomatoes come in first, so focus on them. Magnesium is another important mineral for vascular health. For calcium, I generally try to minimize dairy sources of calcium and focus on plant-based sources. I would say that a good healthy yogurt is probably a healthy addition to the diet, but cow's milk, while rich in calcium, can be overdone. And actually, there's a study out of Sweden showing that women consuming more than 3 glasses of milk a day had more osteoporosis, which is the exact opposite of what you think would happen. This is why we have science and need to study our ideas to ensure that they're factful. Getting away from diet for a moment, poor oral health. We do have an oral microbiome, just like we have a gut microbiome. Actually, the gut starts in the mouth. And maintaining a healthy flora in the mouth is important for good blood pressure control. There's a device called a respirate, which looks like a little iPod or transistor radio with some sensors that you place on your chest. And you put on some headphones and listen to these chimes that tell you when to breathe in and exhale. And essentially, this is a device that teaches you deep breathing exercises, and over the course of 8 weeks can drop your blood pressure significantly without the need for any medications. Very interesting. There's the website. The last time I priced it out, it was in the $200 to $250 range. Aerobic exercise is important for vascular health. You want to work those blood vessels. Relaxation techniques, we mentioned the respirate device, but other things like yoga or meditation are also helpful. Hidden sources of salt. Many patients say, well, I don't add salt to my food, but salt is in a lot of things that you may not be aware of. Pizza crust, cheese, ice cream, pretty much every restaurant or takeout that you get, even the healthy restaurants, use a lot of salt because it's tasty and we like that seasoning. Canned soup would be another one. There are interesting studies. The U.S. Army actually did a very well done study because only the U.S. Army can completely control its subjects. And they put healthy 25-year-olds in a barracks for 2 weeks and fed them once a day meal at 8 p.m. There was a separate barracks. The control group got that same meal at 8 in the morning. And after 2 weeks, eating the exact same thing, the group that ate their meal at 8 o'clock at night had higher blood pressure. So our bodies metabolize food differently depending on the time of day when you eat it. Try not to consume any calories after 6 or 7 in the evening. We mentioned having healthy oral health, and gum disease has been shown to worsen blood pressure. There's actually an interesting study out of Korea. Korean men who brush their teeth 3 times a day have fewer strokes. So it really does make a difference. I endorse a plant-forward diet and hopefully a whole foods diet, meaning that the food is not processed. So white rice is a processed food and it's not as healthy as brown rice. So anytime you can make a switch to a whole food, it's going to benefit your health. I think that our bodies and physiology evolved to be spending most of our time outdoors. And the more that you can make an effort to be outdoors, the better it is for health. This study showed that being exposed to ultraviolet light from sunlight lowers blood pressure within 30 minutes. Coenzyme Q10 from green leafy vegetables. I think I mentioned this earlier in the handout. Here's another study showing its benefit on blood pressure. Getting back to the outdoors for a moment, and I'm an active park scriber. I like to give my patients with a variety of medical conditions prescriptions to go out in nature and really emphasize the importance of this. It's effective, and there are very few side effects to just going outside out into nature. In Japan, they call it forest therapy or forest bathing, and it has been shown to reduce blood pressure. Out of Greece, a lot of the Mediterranean countries take a midday nap as part of their culture, and it has been shown to reduce blood pressure, same as giving up salt and alcohol. We mentioned how alcohol is a double-edged sword. Another study on brown rice and its benefits on blood pressure. Maitake mushrooms have been shown to reduce blood pressure in addition to enhancing immunity. Just having a pet, this is probably a stress-reducing technique. cortisol levels go down. Cortisol is part of your fight or flight mechanism. So having a pet and relaxing a little more reduces that surge of the hormones that increase blood pressure. Drinking tomato juice, unsalted, can reduce blood pressure. There's a great podcast from 2019 featuring Dr. Gemma Newman, who discusses a plant-based diet as a means to achieve control over your blood pressure. Onions, another plant food that has a variety of chemicals, including quercetin, that help to lower blood pressure. Sesame seeds, that's a big dose, up to a quarter cup of sesame seeds a day has been shown to reduce blood pressure. Another study on chronobiology, the study of when you do things, matters. Consuming significant calories after 6 or 7 in the evening has been shown to increase blood pressure. Soy often gets a bad rap, and certainly some people are allergic, but I think that it has so many healthful properties in reducing cardiovascular risk, blood pressure, even certain cancers of the breast or prostate. So find an organic, non-GMO soy and include that as a regular part of your diet. This concludes the blood pressure handout presentation. I hope this was helpful. If you have questions, feel free to message me through the portal or set up an office visit in the office or by telemedicine, and good luck.